Skill 19 provides foot care on one foot. Materials that will be needed for this skill is one barrier or a Chuck's pad that can be placed on the bedside table, a basin that will be filled with warm water halfway, soap, lotion, one large towel, 3 hand towels, and 1 pair of gloves. Good afternoon, Mr. Smith. My name is Chris, and I'm going to be your nursing assistant today, and I'm here to perform foot care. Is now a good time? I will start off by washing my hands, checking the patient's identity with the wristband, or asking the patient to repeat their name back to me. I will gather my supplies. I will provide privacy. I will fill my basin halfway with warm water, checking the temperature with the inside of my wrist. Mr. Smith, please check the temperature with your fingers. Is that okay? And place my basin back on the table. I can now check that the wheels are locked and raise the bed up to my waist level. Before touching the patient, I will don on clean gloves. And expose the area that I'll be working with, which is the foot and a little bit of the leg. I will place down one large towel as a barrier under the foot. Next, I will take my basin and place the patient's foot inside. We will be soaking for 10 to 20 minutes. Now, prior to continuing, you must ask the patient if their foot is comfortable in the basin. Mr. Smith, is your foot comfortable in the basin? Perfect. Once the foot has been soaking for 10 to 20 minutes, we can now wet 2 hand towels, remove one, remove excess water by wringing it, and apply soap. We want to work this into a lather and have everything ready, because once we do lift the foot out of the water, we will be holding it for the duration of the exercise. From here, we can lift up the foot, start washing all surfaces, ankle, heel, both sides of the feet, including in between the toes. Then we can toss this away into the dirty linen. Second hand towel is already wet. We can just remove it by wringing it, squeezing excess water. Rinsing all surfaces of the foot, the heel, the ankle, including in between the toes. Dispose of this in dirty linen. Third and final hand towel will be to pat dry all surfaces, the heel, the ankle, top and bottom, including in between the toes. Dispose of this in dirty linen. And now remove the basin and place the foot down. This we will put it back onto our bedside table on top of the barrier. Next, we will apply lotion to our gloved hand, warm it up in our hands, lift the foot, and apply lotion to all surfaces of the foot, top and bottom, ankle and heel, excluding in between the toes. No lotion between the toes. Now we can put the foot down and use our barrier to remove any excess lotion. From here, we will remove the barrier and roll it away from us and dispose of it into the dirty linen container. Next, I will go ahead and discard my station. I will empty, rinse, and dry my basin and place it into the dirty supply area. Soap and lotion will go back to its designated area. The barrier that I used for my bedside table will go to the trash. I will remove my gloves, throw them away in the trash, and wash my hands. Return to my patient with clean hands, cover the patient's foot back up, make sure that the patient has his call light within his reach. Next, I will lower the bed down to its lowest level. I will confirm that the bed wheels have remained locked. I will remove the privacy, wash my hands, report and document, and my skill is complete.